Hello everyone, welcome back to our Fire Nursing tutorial YouTube channel. In this class, we are going to discuss important MCQs. Who all have visited first time on this channel, please do subscribe and watch. We'll see the first question. Which hormone maintains pregnancy? These are the options here. Right option is D, progesterone. We'll move to the next one. Which position is best for spinal anesthesia? Options are here. Right option is C, that is lateral position. What is the safe magnesium sulfate level in preeclampsia? Right option is 4 to 7 MEq per liter. Which gas is used in laparoscopic surgery? Options are here. Right option is carbon dioxide. Which artery is palpated during CPR? Right option is carotid. Which manure relieves choking in adults? Right option is hemorrhage. Which position is best for cord prolapse? Right option is knee chest position. Which condition causes clubbing of fingers? Options are here. Right option is lung cancer. Which manure is used to deliver placenta? Right option is threads. Which sign indicates ruptured ectopic pregnancy? Options are here. That is Cullen sign. Which is the antidote for morphine overdose? Right option is naloxone. Which condition causes polyuria, polydipsia and polyphasia? Right option is diabetes mellitus. Which sign is positive in meningitis? Carnegie's. Which nerve is affected in Bell's palsy? Seventh cranial nerve. Which ECG wave represents atrial depolarization? Right option is P wave. Which reflex disappears first in infants? Right option is routing. Which electrolyte controls water balance? Sodium. Which disease is due to B1 deficiency? Red option is B, beriberi. What is antidote of organophosphate poisoning? Red option is atropine. Which disease shows strawberry tongue? Is D, all of the above. Which sign is seen in gallbladder disease? Right option is Murphy's. What is the normal urine output per day? Right option is 1500 ml. Which type of shock is due to blood loss? Right option is hypovolemic. Which sign is seen in peritonitis? Right option is Blummer's. Which disease shows pigeon test? Please like, share and subscribe to